Good morning, everyone, and welcome to the second session of the Global Sustainability Author Webinar Series. If you don't already know, Global Sustainability is an open access journal published by Cambridge University Press with Johan Rockström as editor-in-chief and a reputable supporting editorial team. We're delighted to be bringing you this webinar series thanks to our editors and authors. Today, we're joined by special guest speaker, Salim Ali, and in a moment, I'll hand over to Shumei Bai, one of the deputy editors for Global Sustainability, who will introduce today's session. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You have all joined in listen-only mode, which means you'll be able to hear us, but not able to speak to us. However, you will have the opportunity to submit chat questions by typing your questions into the Q&A of the control panel. You may send in your questions at any time during the webinar. We will collect these and address them during the Q&A session at the end of the webinar. If we are unable to get through all of the questions during the session, they will be included in the Q&A document that we will send after the webinar. Should you experience any technical difficulties, please add these to the question box and a member of the organizing team will endeavor to help you. In the unlikely event that we experience any issues, we will message the audience and restart the webinar. So to summarize, you can submit your questions at any time, and you'll also receive a survey at the end so you can let us know how useful you found it and have another opportunity to ask any questions that you have. So to kick things off, I'd like to invite Shumei Bai, Deputy Editor of Global Sustainability.
Thank you, Alison, for the introduction. Good morning, good evening, everyone. My name is Shumei Bai. I'm a professor at Australian National University, working on urbanization and sustainable urban systems. So today's seminar is about cities and COVID-19. So I think we have all seen that COVID-19 has really been a wake-up call for the world cities and our urban way of life. And we have really watched it, the virus really rampaging through world cities one after another. And the pandemic is still running its course, we know, but we're already noticing some key insights that are emerging. And I think there is a very strong need to shed some light to the cities in the global south in this context, where the COVID-19 is really adding additional strain to already severe many of the urban problems. So today's webinar is in that sense very timely in that Professor Salim Ali will be presenting based on his paper recently published in Global Sustainability. And the work is based on case study in Karachi. So Professor Salim Ali is a blue and gold distinguished professor of energy and the environment at the University of Delaware. And he's also a professorial research fellow at the University of Queensland, and also a senior fellow at Columbia University's Center on Sustainable Investment. He has a very distinguished record of research activities, and his fieldwork experience has really spanned over 100 countries on 6 continents. And he has been named because of this a National Geographic Explorer and a Young Global Leader by the World Economic Forum. And he has tons of published peer-reviewed articles and books, including Treasures of the Earth, Need, Greed, and Sustainable Future, which is published from Yale University Press, and Environmental Diplomacy, which is published from Oxford University Press. So I think probably, I should mention this, he's also a member of the United Nations International Resource Panel and the Science Panel for the Global Environmental Facility. So without further ado, Salim, the floor is yours.
Thank you so much, Professor Bai. It's a pleasure to connect with the Cambridge University Press audience. The journal Global Sustainability holds great promise for being a new leading venue in the field of integrative research around environmental and social issues of sustainability. So we are very pleased to have our paper published as part of the intelligence briefing series within the journal. I'd like to specially acknowledge my co-authors who are noted here and maybe joining as well for the Q&A session. I was the corresponding author, but a lot of the heavy lifting was done by the co-authors, and they deserve all our respect and attention. The fieldwork was, of course, done in Pakistan, and the data was collected in Pakistan. I'm actually in Pakistan right now. I'm sorry. I hope can you hear me now? All right. Um, so I was saying I'm in Pakistan right now currently, and trying to do some follow-up work as well related to this research. Now, the topic is one that's very timely, and for me, it's a great kind of personal journey of reconnecting with urban planning. A lot of my research, if you look at my profile, has been more recently much more panoramic in terms of coverage of issues at a global level, and I've not done as much fieldwork in cities as I would have liked. But my PhD was actually in urban planning many years ago, 20 odd years ago. And so it's great to reconnect with cities in a much more direct way with this paper. Now, if we think about the COVID pandemic and the research on cities, the first thing which comes to mind is the density debate. And if we consider public health and epidemiology more generally, it makes some intuitive sense that if you have higher density cities, you would have greater transmittability of a disease and so on. So there has been a presumption around density leading to a higher level of disease prevalence. However, the empirical data provides much greater nuance and texture to this conversation. So density per se is not linked to the rates of COVID-19 among a lot of the counties that have been studied globally in various ways. And one study which was done very early on in the pandemic notes that connectivity matters more than density. And that's the key issue, is how do we manage connectivity rather than density? Now, the World Bank study of 248 cities also illustrates some very counterintuitive findings around the linkage between cities and COVID-19 prevalence. And the real issue becomes lowest per capita income rate transmission too, which one might think of, uh, you know, that in itself is a variable that is contentious in many ways. How do we think about actual per capita income as an indicator of education or other intervening variables? And so we need to really go into the detailed analysis city by city to understand what is going on. And the issue is a certain kind of city. It's the texture of the governance, it's the issues around connectivity, it's the way in which inequality is managed in cities, the way in which public sector institutions interact. That is what matters. And if we simplify the conversation just around density, in fact, it can lead us astray in terms of preventing future problems with pandemics. Now, I wanted to first share some data, not from our own research, but from the research of Professor Bai, who's one of the world's leading scholars in urban planning. And she and her team published a paper very early on, also in the pandemic, that looked at the various aspects of cities and their transmission of COVID-19. And she looked at the country level as well as within China, specific city governance decisions, which led to different kinds of outcomes for cities. So on the left side, the global cities comparison shows us that there is really no clear linkage at all. If you look at population density on the y-axis, and you look at the time between the first case and imposed restrictions also, you see that there is this kind of scatter plot that's emerging. And what that shows is that, we need to think about the way in which this kind of decision making plays out. The size of the circles is giving you the confirmed cases per 1,000 population. And so that's taking in account the actual size of the city. And what we find is, cities like Buenos Aires, where you've got a very high case load per 1,000 population, um, you are seeing this kind of very complex interaction that is taking place. And we need to really go into a deep dive into each one of these cases to see what is the lesson to be learned. With the Chinese case examples, we can see Wuhan is a real outlet for virus started, and often, there is some kind of ascription of blame around the delay in decision that was made with the restrictions imposed there and the impact that the spread had as a result. And you can see that from this kind of outlier that it shows up. And some of it can be said that because it was the first time that it was happening, the city was just not prepared. It was an unprecedented event at one level. So one shouldn't, just blame the city government for it. But clearly there is some concern there that needs to be addressed as well. Now, if we go into the Karachi case study, we are conscious of the fact that the data itself gets questioned. And we've tried our best to make sure that the data is reliable from the local government. And this has also been verified through some journalistic triangulation to look at not just the prevalence of the cases themselves, but the mortality rates, which is often much more indicative because many times people are not getting tested, and so that also plays a role. But of the 5 hotspots in terms of number of cases, there's significantly, I'm going to show you a map which highlights those black dots that are referred to in this slide. The concentration of COVID-19 in Karachi South may be attributed to many different factors. And again, connectivity becomes significant because there's one particular neighborhood, the southern area, which has a high concentration of commercial activity. And that's where you see a lot of the very high level of cases. We did account for the fact that some of the wealthier suburbs were getting more testing. And so that does play a role too. So this is the map which I was referring to, and the black circles are showing you the highest number of COVID cases per 10,000 population. And the color coding of the neighborhoods is indicating the density. So the darker color coding shows a higher density as well. So there is, again, not really a clear pattern because the highest density areas do not necessarily have the highest COVID cases per 10,000 population. And even if you look at the mortality data, which is giving you some indication of whether the testing issue is playing a role, we do find that that is also not a significant factor. And in the early days of the pandemic, you may have come across also from the epidemiology research, some other counter narratives that in South Asia, there is some inherent immunity to coronaviruses. But the recent India cluster of cases and the terrible mortality in India has shown us that South Asian immunity hypothesis is highly questionable, even though there are still epidemiologists who say that the mortality per capita is not as well explained by just the direct transmission. It's quite clear that that is still, it's not a dominant variable by any means, that there is some kind of inherent immunity that certain parts of the South Asian urban population have. And often the immunity hypothesis also comes through that the poorer areas and people who have very high levels of exposure to pathogens, they tend to get higher level of immunity. But that has, again, not been played out as much as we would like to understand as some kind of dominant factor. So that's important. I'm trying to cover all the different bases, bringing in the public health literature as well as the urban planning literature. Um, Now, the number of COVID cases versus population density, the scatter plot, again, you see it is all over the place. And what we do find is that the population density on the x-axis, it isn't there. There's clearly not the same level. In fact, the clustering is much more counterintuitive in this regard. So we also then looked at this data from by and this was after the peer review. Actually, the peer reviewer said you need to look at socioeconomic variables as well. So we found the data by socioeconomic cohorts, and there's 6 of these cohorts which were looked at. And this is where you do see that clearly with the low to middle income populations are more vulnerable in terms of case density. And so especially, and you see low to middle income here, where there's probably also a little bit more testing going on, we are seeing that there is much more prevalence. So inequality does play a factor much more so in terms of the COVID case profile. So the lessons from the pandemic, if we were to sort of sum up overall, there is this notion that there is this sort of inclusive planning approach that is going to create more resilience. And it has become almost cliched that we need to be inclusive in planning, but it becomes even more relevant in the case of a pandemic because the data itself is so unreliable and the science itself becomes to some degree very dynamic and has to be constantly changed. And that has sadly led to a distrust in science. And so inclusive planning beyond the cliche becomes even more important in crisis situations, because the people on the ground are often, they have the pulse on the problem. And we have notions of citizen science and actually having much more ingrained level of knowledge at the level of the community that becomes more important in these cases. So that's clear in the Karachi case as well, and we've seen that from many other data sets. More equitable resource allocation of public services, also absolutely critical. And we see that those communities which did not have that had much higher mortality as well as prevalence rates. Neighborhood government empowerment is important because it leads to creative solutions. It's not just about, giving more devolution and authority, but many times neighborhood governments are able to come up with new ideas and solutions in a crisis, which if they're just told from the top down, they may not be as useful for them. And what is important is convergence. You do need some coordination from the top, but you need to let the creativity for solutions also blossom from the bottom. So you need that sense of convergence and communications much more effectively in the case of cities. And that's the strength of cities, because cities give you that proximity. The neighborhoods and the top-down communication in cities is much better than in rural areas. So you get that much more tighter coupling of that communication network. And then finally, what we have found is that urban mobility has been the major source of spread, and how that urban mobility is managed, that is the key factor. In many developing countries, cities, where the urban mobility has been fairly isolated just because of lack of infrastructure, we have not had as much disease spread as well. In high density developed country cities, also, if the urban mobility is well managed, comparing, for example, Hong Kong and New York, Hong Kong had a much better response in terms of managing their urban mobility during the pandemic. They didn't shut down everything, but they were able to manage the subways and how the various protocols were practiced there. That played a definite role. That was much better in sense of controlling the pandemic there compared to New York. Okay, and then finally, we need to consider how cities are going to learn from this pandemic moving forward. And this is where it's so important to figure out the green recovery approach that is being practiced. And this is a scatter plot from the Green Recovery Observatory at Oxford University, where they are monitoring in real time, more or less, what the spending is on the recovery allocation by country. And this is the most recent one I just got, last week, the diagram that they have. And what we see is that the size of the circle is telling you the amount of spending per capita. And you are seeing on the y-axis, the green recovery spending as a percentage of the total. The x-axis is a log normal distribution. Oops, sorry. And what we find is there are some unusual examples which deserve further research. Like Turkey comes out as pretty good in terms of its green recovery spending as a percentage of the total. So this, again, cities will be the leading player in this. And in Turkey, for example, it has a mega city, Istanbul, a city with over 10 million population, and has had very serious outbreaks, but the green recovery spending has been pretty good. And in other cases, countries like Australia, one of my countries of citizenship, as well as for Professor Bai, there is a lot of money being spent, but you do not, and highly urbanized country, because in Australia, you have, I believe it's almost 90% of the population lives in cities. And so you've got still the green recovery metrics are not as good as one would hope. So, this is the kind of dynamic which needs to be observed very carefully. Countries like Brazil, again, highly urbanized, over 80% living in cities, which have been really ravaged by the pandemic. How will they use their public sector expenditure for the green recovery? So I'll end with this quotation from the head of UN Human Habitat, the United Nations Human Settlements Program. Basically, the endurance of cities is going to be tested. And there is this realization that infinite growth is not an option. So cities will have to downsize at some level. And the work from home culture is going to definitely take root. Cities will have to reinvent themselves, but cities will endure. And the pandemic will hopefully lead to a green recovery that will lead to this kind of a reinvention of cities, reimagining of cities, which perhaps without the pandemic we would not have seen. And we saw that in Pakistan. Last week, Pakistan celebrated World Environment Day. It was the host country for World Environment Day under the auspices of the United Nations Environment Program. And one of our co-authors, actually, Dr. Naveed Iftikhar, and as well as our co-authors, Iman Khan and Shua Khalid, were very involved in this effort. They have an organization called Urban Innovations, and they led the charge for a city's greening campaign. And even the foreign minister of Pakistan was on a bicycle in the middle of the city, trying to show that the recovery of Pakistan cities will be a green recovery. So I'm quite hopeful that cities will show that endurance in a positive way, and we will have a greener recovery. But we have to keep the momentum. Those of us who study urban planning have to keep the momentum that this lesson is indeed learned. So thank you so much, and I look forward to your questions.
Thank you very much, Professor Ali, for your very insightful introduction of your paper, you and your colleagues' paper. So I found it really interesting because it resonates with many of our own studies, but also I think you have also added very unique perspective from the global South cities. For example, how inequality actually matters and how important it is in terms of the outbreak of the case. And also, I thought it was really interesting that you mentioned there's this immunity hypothesis of the South Asian, which also debunked. And that really led me to think there are so many myths about this urban life or urban, how, cities work in our, even in our research, literature. For example, I think the density debate, as you have also mentioned, it's really reflecting the structural deterministic sort of perspective, which is quite prevailing in many urban literature. But I think this pandemic really showed us that's not really the case. It's, it's not the structural deterministic structural pattern that is more important, but it's the governance, the management, for example, the neighborhood governance, and, as you said, the curating urban mobility, those sort of management and governance of the cities are much more important than their, physical structure. So I will be opening for, welcome any questions or comment from the audience. Okay, while people are trying to come up with their questions, I have one question. I think you mentioned that in some of the wealthy suburbs, there might be a bit more testing, and therefore they might have identified some more cases than some of the, low income suburbs. I was just wondering how this inequality influenced, to what extent the inequality really influenced the outcome, and the reliability of the data itself. What is your feeling after doing this Karachi case study? Can you give us sort of a magnitude, like, should we look at, if we look at the data reliability, is it double or is it triple, or how should we, grapple this issue?
And this is where the importance of civil society is so important, so vital, to make sure that the data verification, especially government data, is held to account. And I'm happy to say that in Pakistan, actually, there is a lot of civil society activism around data gathering and effectiveness. And so many times if the government is seen as grandstanding or not providing the information accurately, there's a lot of pushback. There are people who will go out on their own and try to get the information. But I would also like to invite, we have two of our co-authors now joining as well, if they would like to say something about the data. So Iman or Shua, if you have any comments on your views on the reliability of the data in Pakistan, please feel free to unmute and comment. Iman or Shua? Shua, okay.
Hello, can you hear me?
Yes.
Yeah, just to add to that, I think like we did find data like just as you said, like in low income areas, the people are less likely to get tested and hence lower cases are reported. And that is something that obviously that is a data limitation in the paper, and like Dr. Salim said, that we would like to overcome that in the future with more, encouraging people to get tested more, and just like government interventions also. I also feel like the government has increased its scope of testing now. So in the future, like if we do another paper, we will have a bit more reliable data even from low income areas. So yeah.
Thank you. Yes. Yep. No, and in terms of also the triangulation with the journalists' accounts, we did try to do that. That's always useful to some degree because people are out in the field and saying, look, this doesn't seem right. And so we have tried to also do that much more so. But you're right, we have to constantly, it's a struggle to make sure that information is accurate. But mortality data, we also did look at hospitalization. We didn't, hospitalization and death, it's not put in the paper because we couldn't get it for the whole city in the same way. But the preliminary research shows that the mortality data correlates with what we're getting from the COVID testing data, in terms of that people where there's lower prevalence, there's lower death. If we were seeing there was higher death and there was lower prevalence, then there was something weird going on possibly. But And I think there's a question in the chat.
There's a question from Dr. Yuan Peng. It's basically about the bottom-up solutions are important. And the question is how these solutions can be shared and be used by other communities, I guess. And what sort of support are needed for sharing those lessons and be helpful to, I guess, other communities.
Yes, so, in terms of bottom-up solutions in Pakistan, one of the things that we have seen is that Pakistan it's a very religious country, and community organizations that are linked to religious organizations have a lot of influence. And so if you can make that connection, and it's regardless of whether one is personally religious or not, but one should be instrumentally using whatever social capital institutions are there. In the case of a country like Pakistan, they have been very powerful in different ways. They can be both positive and negative. They're giving the wrong message, they can create trouble too. But in many cases, we did see that these institutions, like during an earthquake, we had a terrible earthquake over a decade ago, and these religious institutions mobilized the community response in a remarkable way, which could not have been done with the top-down approach. In the pandemic, it was more complicated because some of these institutions were spreading narratives which were more difficult to reconcile with public health. But in other cases, they were, spreading information which was positive, and then people were really believing them. So that's one sort of specific example from Pakistan, which does apply to other countries, especially many other Muslim countries, where there is much more trust in religious institutions to play that role. We have seen that even in the US, in the southern states, where there has been a lot of vaccine hesitancy, that church groups which have promoted that have done well. The other thing with reference to support for community, like how can we, the question also asked, like how can we support communities? I think the financial question is always going to be there, like how many financial resources can you mobilize? But beyond the financial side, these communities, what they need is a voice at the table. They really need a mechanism whereby the government decision makers are able to listen to them. And that communication channel being open with the government is critically important. And one of the things in Pakistan that people would say has been worthwhile is that there is a much greater level of communication that has happened now in the last year or so because of the pandemic, and people really trying to mobilize that kind of communication. But Shua and Iman, feel free to also provide your input.
Hello, can you hear me? Iman. Hello.
Yes, Iman, we can hear you. Go ahead.
Okay, great. I also think, just anecdotally, one thing that we saw when we were doing our research was that, like you said, religious institutions can play a very positive role in other communities. For instance, there was messaging from mosques to carry out, certain distancing measures or certain hand washing procedures. And I think those are the kind of things that can be applied in other contexts too. And another focus of our paper, which was on supporting neighborhood level initiatives, I think is a lesson that can be applied across contexts, because once you start mobilizing neighborhood communities and giving them more of a role and having, like you said, a seat on the table with people who are willing to take them more seriously, that's something that can apply across contexts.
Thank you.
Absolutely.
I think there's another question. Is it? Yeah, it's a comment from Professor Mark Dissendorf, which requests you to discuss a bit further on the implications of COVID for public transportation in cities.
Yes, so cities, one of the real challenges that we see from an environmental point of view, and a lot of my work is system science oriented, where I look at industrial ecology metrics like life cycle analysis, looking at the different comparisons of what happens if you move from one product to another. So one clear concern we have is that the pandemic may lead people towards more individual mobility, people wanting to have more cars because they're afraid of going into public transport, which would be potentially a very negative outcome from a sustainability perspective. And the initial data from China was indicating that that was happening. But it's hard to tell because China already is going through such a huge growth burst in terms of individual mobility. People want to buy cars and so on. And so that it may be happening anyhow. But we do know that in the case of the US, there has been also a recognition that there will need to be some new kinds of models for transportation, more hybrid models that will need to evolve. So that could come from a shared economy approach where there is slightly more individualized mobility, but still lower impact than everyone owning a car. So like, of course, the use of more shared mobility services like Uber and so on, but then having quality control around them from public health perspective. If we can build the same confidence with public transit, I think that would be the best outcome. And that's why Hong Kong and some of the East Asian mega cities have been very good in that regard. You know, giving people confidence that you have public health measures that will protect them. But then some of that will need to come from enforcement at individual level. So the use of masks, absolutely the data is convincing that in public transit, if everyone is wearing, the risk factor is reduced a quantum level that it is just as well as being in your own car. So then you have to get enforcement, and you need, that's a social and cultural issue. In the case of East Asian cities, they were very used to having masks anyhow. Even before the pandemic, people in Taipei and Shanghai and other cities were wearing masks anyhow. So it was easier. In America, people are not used to wearing masks, and it became a very political issue. And so urban transit enforcing people to wear masks became problematic, and then it led to the more individualized transport. I think a lot will remain to be seen what happens in a city like New York, which is slowly reopening, and there is a major mayor election coming up. There are over 20 candidates to be mayor of the city. And this is urban mobility and safety is a key issue right now in New York's election of the next mayor. And how New York handles it, given the cultural context of the individual right to your, wearing of masks or not, and so on. That will be very interesting to see how it plays out and the confidence that's built in. So yes, I think from a sustainability perspective, transport is going to be absolutely key moving forward to see what happens with cities. Because one of the great incentives to live in cities, and one of the reasons Australian cities get such a high level of quality of life index, is because the public transport is so good. Everyone in the indices, if you ask them, it'll be like the number 1 or 2 factors will be around transport, access, and then parks and recreation and so on, and safety, of course, as well.
So I have another question, actually. Because of this pandemic, especially in some of the developed country cities, we see people shifting away from cities, right? Some of the wealthy or middle class people trying to get away from the city and going to the suburban sort of areas. Do you see similar trend happening in Karachi, for example? And the question, the next question would be, do you think this pandemic will become a trigger for people to shift away from cities in a scale that actually counterbalance the urbanization sort of rate?
I think what is happening is polycentric development. So you are getting cities expanding into clusters of satellite cities. And so a lot of them are becoming very self-contained. So, for example, Karachi has many of these suburbs which are very self-contained. So people do not have to go to the old urban heart as much. You get everything within that self-contained city. And this goes back to sort of the vision of, acoustics and all the, going back to Konstantinos Doxiadis and his vision for ecological planning. And actually, Doxiadis was the guy who planned Islamabad, the capital of Pakistan. He was the urban planner for Islamabad. And he designed it in that way, that you have each sector in the city is self-contained. It has a market, it has a residential development around it, it has an industrial area, and then you have these areas. Now, whether that has been managed well or not is a different question, but that's how it was designed. And I can see that happening as cities grow, more of this kind of polycentric development. And then there would not be as much of a commuting pressure going back into town. And that I see cities developing in that way, especially from the work from home context. That will work very well. And you would still get the same kind of urban life and the vibrance you want from a city, but it will happen in that domain. That's more likely, and that's going to be in the developing world as well as in the developed world, I believe.
So certainly this pandemic is going to be a trigger to reconsider how we develop our cities and how we organize our life, I guess, around the cities. I see there's another question here. In terms of the green recovery, do you see any patterns of particular green technology that are preferred by countries and cities?
Yes, so, with reference to the green recovery, a lot of the emphasis is around the way in which infrastructure is being developed to take into account sustainability indicators like carbon footprint, water usage, and so on and so forth. There is also greater recognition for like internet access, so that people can work from home, and making sure that there is the high level of bandwidth for access that way. And that in itself has certain interesting metrics, because working from home also has an ecological impact. It can be very energy intensive. You need the servers and where they're located and the energy sources and so on. And actually, I've made a short documentary for the UN Environment Program about that issue, the material needs of working from home, which are considerable. Because, for example, if you need high-level internet access across the planet, you need all these underwater cables and so on. But it's still much more manageable in many ways if it is coordinated compared to having everyone commuting back and forth too. So that is part of the green recovery. If we go to the Oxford Green Recovery Dashboard, they have a really good set of metrics that they have set forth. So I would encourage you to visit that, and they're doing it in real time. So you can see, how they're tracking the various indicators. One of the other aspects of the green recovery is around, going back to the question of mobility, is if people are going to be working from home, they don't have to commute, then you need much more bike use, bike paths, and having a much greater community-oriented mobility network. So going from home to the market, bikeable paths, or having other kinds of pedestrian infrastructure. So that's a big metric that they're using in the green recovery output. And we are seeing that definitely a lot of the cities are rebuilding around that in the developing world as well. And they've been tracking that in Pakistan. That is one of the big new efforts also, is to make sure that the urban transport around pedestrian and biking is improved.
I would just like to add to that what Dr. Salim just mentioned about a greater initiative of the government towards biking and building pedestrian pathways. that focus has shifted dominantly because of COVID, because people felt that that was the only sort of like recreation and safe social activity that they could also do. But in a very real sense, it has changed the way the government used to think about cycling and all of these green initiatives. So COVID has definitely helped shift that perspective and thinking in Pakistan.
And I see a very good question here by Dr. Haiyan Liu from China. What about the vaccination in Pakistan? Do you think after the full vaccination, the cities can go back to its way, normal, usual way, or what may change permanently? I think the last part of the question you sort of answered, but yeah, any comment on the vaccination?
Yeah, the vaccination issue overall in Pakistan, we are still way behind most countries, but there right now, I think it's uh, primarily an issue of just delivery. Once it's there, there is vaccine hesitancy in some areas, but I think that can be easily overcome because there is a history of vaccination. Pakistan has had a very strong polio vaccine campaign because it was one of only 3 countries in the world where we still had polio. And so there is a big infrastructure around polio vaccination that has been very effective, and it's very at the community level in the remotest villages even. There are these polio vaccination campaign efforts. And so that whole network has been mobilized for COVID as well. And so once the vaccines arrive in adequate quantities, I'm quite optimistic that they will get the uptake. There will be some hesitancy. There are the conspiracy theories. We had that problem with polio too. People thought that vaccines are going to lead to birth control, forced birth control, and all kinds of strange conspiracy theories. That is there in some circles, and that's again where the role of the religious institutions in promoting a positive narrative is going to be important, because a lot of those people will trust the religious institutions. But in terms of bouncing back, the country made a decision earlier on that they were not going to do complete lockdowns. They said they would do smart lockdowns. And this is where, Pakistan, even though there are, of course, concerns about the level of centralized control, and we want neighborhood level authority much more. But in some instances, centralized control can be helpful too. And one thing we found in Pakistan was that enforcing smart lockdowns, the role of the military particularly was helpful, because the military has a very large infrastructure in Pakistan in terms of enforcement capability, and there is a lot of trust in the military. And so during the smart lockdowns, like what they would do is, okay, if there were certain cluster of COVID cases in a neighborhood, they would shut down those streets completely with access, just those streets, rather than just, saying blanket shutdown of the whole city. And the military was brought in to enforce that. This was done in especially a large city like Karachi, which very difficult to manage, over 20 million people. So the role of the military in that regard was helpful. And Pakistan's military, we have a very high population percentage of populations connected to the military in that way. I mean, there are, of course, problematic aspects to that. You don't want too much military interference in civilian governance, which has been a problem in Pakistan too. However, in this particular instance, it was very effective. And I think that's been the reason why so far we have not had as much of a problem as some of our neighboring countries.
Just one more thing to add to that, like the bigger vaccination centers are also open 24/7. And combined with that, basically the major problem that is being faced by a country like Pakistan is that people are not coming in for their second doses. A huge population is not coming in for the second dose. And I think this is very similar to the problem faced by US as well. It's also because the symptoms are a bit more dominant, like people get feverish after the second dose, these are some of the reported side effects. So it's just like a campaign needs, obviously we need to have a campaign against like a campaign to encourage people to come in for their second dose, and a higher level of intervention and public messaging by the government to make sure that the public comes in and gets vaccinated.
Mhm. I think we're almost time, but there's one more question here. The pandemic is trigger for positive change in cities, and as the world is making progress toward fighting COVID, what can we, would or should do to capitalize on the opportunities presented by the pandemic and making cities better, greener, and more sustainable? I think to some extent you have touched upon various elements of it, but if you'd like to add, briefly.
Yes, so I think we have to approach this with humility to some degree also. We are still learning lessons on this. The data, there will be so many PhDs written on this, in the next 10 years. The scientific community, one of the lessons for me as someone who serves on a United Nations science panel is, one lesson is scientists need to be humble just as much. We made so many mistakes, but even top journals like Nature and Science, they jumped the gun, published data, studies, which then countered. It led to an erosion of trust. We have to, on the city's question also, we will need to be very vigilant about looking at the data, scrutinizing it, seeing the lessons learned. Even within 6 months, the lessons of the cities of India are not applicable now because everything has changed since the March, April surge. We'll have to go back and look at the data. Why was it Kerala was very successful? The state in Kerala throughout, it's been successful in the past in many other areas like education. We'll have to go down at the neighborhood level, look at the data there. Similarly, in Pakistan, we will have to look at different aspects of the same kind of resolution. There is a program, the Global Environment Facility, which is the major funding body for the major environmental treaties that I'm on the science panel for. We have a sustainable cities program. So one of the things that our science panel is going to pay a lot of attention to is the proposals that countries submit for the Sustainable Cities program moving forward. There's the Global Platform on Sustainable Cities. I would urge the audience to keep a track of that. That's managed by the World Bank, and they will be looking into how the green recovery is being implemented, how it's being monitored. Because sometimes, you may try something, it may not work. You'll have to constantly recalibrate it. Interventions, social and behavioral changes are maybe not going to be responded to in the same way. So we will need to be really vigilant not to jump the gun this time as we rebuild, and especially with infrastructure decisions. Because once you invest in infrastructure, it's much more difficult to change it. So we'll have to be very nimble and flexible about what kind of decisions we make on infrastructure.
That's excellent comment to close this. I think to the need to be vigilant and really humble for all of our researchers here. I think it's really important lesson, take-home message from today. So I think time is up. So I'm going to hand it over to Ali.
Yep, sure. So I hope this Q&A was helpful. Lots of questions, and I hope it answered anything that you might have had. I really hope you've enjoyed the webinar and found it useful to hear from Salim and learn more about global sustainability. So I really like to thank both Salim and Shume and the co-authors for their time in taking part. There are more webinars in this series to register your interest for. So please do check out the information on the Global Sustainability Cambridge core page. Thank you very much for attending.
Thank you, everyone.
Thank you. All the
Thank you
best.
for the invitation.
Thank you.
Bye-bye.
Thank you.